evening, everyone. Welcome to Lifeways. Today, we will be talking about a very important topic, and I'm very excited to bring you this topic because it is an understanding of the foundation of all diseases. We will be talking about inflammation, the fire inside. Now, inflammation is a very normal condition. But before we go into inflammation, I would like to introduce myself. I am Dr. Carolle Chapman. I'm a naturopathic physician practicing here in Portland, in the southeast area of Portland. And I am at the Brooklyn Natural Health Clinic. I practice a particular kind of natural medicine called biotherapeutic drainage, which is focused on prevention and removing all obstacles to health. In this way, I would like to share with you that I have been presenting the show for the past 5 months. It is a call-in show, so you are welcome to call in and share your questions or comments. So please call in this evening as we move forward on our topic. Inflammation is a normal process in the healing, a normal part of the healing system. Actually, inflammation is a good thing because it helps us to ward off invaders, and it is a beneficial process that protects you from injuries as well. It is the first step, actually, in the healing process. Now, if your immune system mistakenly triggers an inflammatory process or an inflammatory response when there is no threat to you, then this can lead to what is known as chronic inflammation. Now, that is not a good thing. And that is our concern. That is why we will be talking about chronic inflammation as a precursor to so many conditions and diseases. If your immune system is weakened as well and it cannot quite get rid of the invaders, then what it will do is attempt over a long time to try to get rid of these invaders, but this will eventually turn into a chronic response in terms of inflammation. This is not a good situation. So excess inflammation is linked to many diseases. For example, asthma, allergies, autoimmune conditions, heart disease, cancer, and many other diseases start off as chronic inflammation or have chronic inflammation as part of the disease process. Actually, excess inflammation is linked to all chronic diseases. Depending on the organ that is affected, we give different names to this chronic inflammation. For example, if the inflammation is in the heart, then we have what is called myocarditis. As you see the ending of that word itis, any word that you see ending with itis is indicating that that particular part of the body or system is inflamed. Notice, for example, in this inflamed heart in myocarditis, how the spaces between the muscles that make up the heart is actually narrowed. So the normal blood flow is blocked, and that is a serious situation. Inflammation of the small tubes of the lungs or the bronchioles is called asthma. Here is a normal lung. You can see has a wide space or opening. And in the asthmatic lung, you see how narrow that space is. So the difficulty in asthma is that the blood is not able to pass freely through these bronchioles into the deeper part of the lungs where gas exchange takes place. That is, as we take in oxygen and we give off carbon dioxide as a waste product, the lungs function to take that oxygen as our first nutrient to all the tissues of the body and to get rid of the carbon dioxide as that waste product. If, however, we cannot do this freely, then this is the difficulty of asthma, where we have shortness of breath and the inability to get that air out of our lungs that we want to breathe out. Inflammation of the kidneys is called nephritis. Inflammation of the large intestines is colitis, and that is associated with cramps and diarrhea. Here is a picture of a normal, healthy colon. On your left and on the right, we see an ulcerative colon. That is an inflamed colon with ulcers on the surface. The inflammation of the joints is called arthritis. That's a very common condition. And actually what happens with arthritic joints, first there is swelling, there is pain, there is redness sometimes, and there is decreased flexibility. That is, you cannot move your joints as freely as you would like to, and therefore your movement is impeded. Here is a picture of an arthritic hand. The fingers have been deformed and they have lost their flexibility. The arthritic knee on the left is swollen, and also certainly pain is associated with that and the inability to move the knee freely. Here is a septic arthritic knee. That is, you can see an entry point where some form of bacteria got in through the skin and the knee responded with a massive inflammation. There's the redness, and of course pain is associated. So what is the difference between chronic and acute inflammation? If you get a cut or you have an injury like a swollen ankle, a twisted ankle, then immediately you're going to have that acute response where the ankle will swell up or your finger will swell up, and this is the body's form of addressing that condition or that situation to limit the damage and to send white blood cells and other immune messengers to clean up that area and to start recovery and repair. However, if you are in a situation where the inflammation is going on for several days into months, then we're talking about chronic inflammation. Let's look at a few situations of acute inflammation. The symptoms are typically redness, as we saw in that knee just now. There is warmth, and definitely there is pain. It is obviously swollen. You will see that ankle is swollen, and you will not be able to move that ankle freely. In fact, if you attempt to put your normal weight on the ankle, the pain will increase. Chronic inflammation, on the other hand, as I mentioned just now, will go on for a longer period of time than the acute inflammation. So it is often seen that there are no symptoms associated with that chronic inflammation at first. And then one day you realize that you are not quite functioning properly, or you then begin to have symptoms, but usually this can go on for years before you have the first symptom. So in that case, you will have had extreme damage done to that organ. Say, for example, that ulcerative colitis, it took many, many years to have developed that inflammation and the ulcers on the colon, so that the person may not have had any indication for during those years, and then they start having cramps and diarrhea and so on, and difficulty with digestion. So this chronic inflammation is a low-grade situation that is damaging the tissue, the organ, or the system involved in a silent way. And this is why chronic inflammation is referred to as a silent killer. Here are some diseases related to chronic inflammation. We have heart disease. Usually a heart attack or a stroke is definitely has as its base chronic inflammation in the heart. Alzheimer's disease, cancer, autoimmune diseases like multiple sclerosis, ulcerative colitis, Crohn's disease, autoimmune hypothyroiditis, rheumatoid arthritis, a very common one, and lupus are all autoimmune diseases that start off with chronic inflammation. We see here a cross-section of the brain showing areas of plaque, and these plaques were laid down on the foundation of inflammation over a long period of time, causing the brain to not be able to function as it should. Here again is ulcerative colitis, chronic inflammation, Crohn's disease, chronic inflammation of the colon as well. Rheumatoid arthritis, here is a picture of a rheumatoid hand. You see the deviation and the deformity of the joints of the hand, and of course the inability to flex these joints normally. It is also associated with pain and with swelling. Lupus, here is a young woman with the typical marks on the face related to lupus. Okay, let's take a break. I would like to let you know that you can call in. This is a live show. Please connect with us and call in 503-228-4442 or 503-228-4448. Lifeways, you can reach us as well through the website if you are do not have access to a phone, or you cannot reach us right away. Please email life_ways, WAYS, @yahoo.com. That's life, LIFE, _ways @yahoo.com. Let us continue. Here is another slide showing chronic lupus, the body. Actually, this is taking up the entire body. We're just showing you the upper part of the body. So this is a widespread chronic condition. Here is an inflammatory breast cancer. You can see very clearly the typical features of inflammation, the redness, the swelling, of course, painful and very painful, any attempt to move. Lung cancer is a form or foundation, has the foundation of chronic inflammation. Smoking, of course, is one of the main causes of lung cancer. So, what causes chronic inflammation? This is an important question because, as we just saw from the examples, that it is a widespread and at the same time it's the foundation for all these chronic diseases. So this can result, the chronic inflammation can result from malfunctioning or overreaction of the immune system, or it can be due to an underlying problem that the body is trying to get rid of. Many of these underlying problems are actually due to unhealthy lifestyle. So this is something that we can do something about right away, because here we're talking about lifestyle habits that is influencing or allowing or promoting chronic inflammation in the body that leads to these serious diseases as we have just discussed. Eating oxidized or rancid fats is another cause for chronic inflammation, and sugars of all kinds increase inflammation in the body. Eating healthy fats like omega fats or essential fatty acids like gamma-linolenic acid will reduce them. And these healthy fats are found in seeds and plants and fish and vegetables. And we have a few examples I'm sharing here with you, such as flaxseed, borage, and evening primrose oils. These are all available as seeds, and they're available as supplements as well. Let us look at some of the risk factors for chronic inflammation. And please note that these are very, very much related to lifestyle. For example, being obese, eating a poor diet, having a history of heart disease in the family, or you yourself having a condition of heart disease. These are all risks of chronic inflammation. Diabetes, especially diabetes that's poorly controlled, is a risk factor. A sedentary lifestyle of not having regular exercise or no exercise at all is, again, a very big factor in the buildup of inflammation in the body. Long-term infections, of course, gum disease, and stress is one of the big ones for creating inflammation in the body. Now, how can you determine if you have chronic inflammation? That's an interesting question. Well, there are tests that can be done that are indicators of inflammation in the body, such as the C-reactive protein. This is a test that's done conventionally that measures a protein in the body, and the presence of this protein is a signal that there is inflammation going on. The ESR sediment rate is a specific indication for inflammation, and fasting insulin is also, interestingly, an indication for inflammation. The higher the insulin, the higher the level of inflammation in the body. Free radicals. So free radicals are related very, very closely with chronic inflammation. What free radicals do or are basically are unstable molecules. All or tissues or cells are made up of atoms, which in turn make up molecules. So if we have unstable molecules or atoms that are in the tissue, then it tends to attach itself. These unstable compounds tend to attach themselves to the cell membrane or the nucleus of the cell. Now, the cell membrane needs to be intact in order to receive messages, to communicate with other cells, and to do the internal function that a cell normally does. If the cell membrane is damaged by these free radicals that are trying to stabilize by stealing electrons from the molecules that are in the cell membrane, then this creates a situation where the cell membrane structure is destroyed and it can no longer carry out normal function. So free radicals tend to damage the cell membrane and especially the DNA in the cell. Now, this is very, very serious because the DNA is our blueprint that the cells use to produce the new cells every day. And if this blueprint is damaged, then it is going to produce damaged cells. And this leads to many forms of inability to function normally. But if over time we have a collection of damaged cells, then this is the foundation for the formation of cancer. Over time, the DNA damage becomes too difficult to repair, as the cell normally has that capacity to repair the cells. And if it gets out of hand in this way, then we have what we now normally call cancer. And depending on the area of the body that this is occurring, then we have different types of cancer. By the way, free radicals are also related to rapid aging, cancer, chronic disease. So free radicals are not our friends. And we will see in a little while why these free radicals are around and why they are able to cause so much damage. And this is related very much to our lifestyle and especially what we eat and what we are exposed to. So environment, lifestyle habits play a very big role in the process of inflammation, the aging process, and the development of chronic diseases such as cancer, as we just mentioned. Here are some common sources of free radicals which you need to know. Harmful smoke. You may not be a smoker, but harmful smoke is a cause for the formation of free radicals in the lungs, for example. Bacillus infection, that's a type of bacteria. Detergents, agricultural chemicals. This is an environmental problem. If you work in these kinds of conditions, then you're exposed to these chemicals and dyes. Ultraviolet rays. There is some concern about being out in the sun for too long. This can lead to an overexposure of ultraviolet radiation. Then major operations are always a major assault on the body. So free radical damage does occur because now the body has to have this assault that it has to overcome to repair the tissue that has been operated on. We also have food additives as a major source of free radicals, stress and not breathing. Interesting how so many people are not taking full breaths as we breathe each day. It's quite an unconscious process, but if you notice yourself, you will realize we are not really breathing from the abdomen, filling up the lungs, and therefore we're not getting the full lungs filled with oxygen. And remember that oxygen is our first nutrient, so it is very important that we do some deep breathing, and this can be done at any moment during the day, or we can take a little time aside and just relax and fill our lungs with oxygen. 5 minutes and you will feel the difference. So how do we deal with this chronic inflammation that we're talking about? In conventional medicine, the usual approach is anti-inflammatory drugs. And we are very familiar with some of these anti-inflammatory drugs, such as aspirin or non-steroidal type anti-inflammatory drugs, such as ibuprofen. But these should be approached very carefully because there are some serious side effects to be considered. For example, Vioxx had to be ended up killing about 60,000 people from strokes and heart attacks. Now, that is a serious situation when you have 60,000 people dying from taking a drug. Statin drugs are also frequently prescribed, to combat inflammation and reduce the risk of heart attacks. Statin drugs, however, also have a very long list of serious side effects, so it is important to know ways in which you can control high cholesterol without statin drugs. Prednisone is another conventional drug that's often used for inflammation. Occasionally, this drug is needed. It can be life-saving, but again, the choice, the timing, the situation must be carefully evaluated. So often these drugs are used as Band-Aids to get past pain, which is a part of the inflammatory process. And it is important to get someone who is in serious pain or even slight pain from relief from this pain. But at the same time, the risk and the cost must be measured so that we seek the way of least harm, so we don't have these secondary side effects to contend with while we are trying to get pain relief. While the underlying cause of chronic inflammation, if the underlying cause of chronic inflammation is allowed to go on undetected, that is, if we focus on just getting a person out of the pain and not look at the cause of that pain, then we can be taking prednisone or ibuprofen or aspirin for a long time. We are not in pain, but at the same time, that condition that is the underlying cause of the pain is allowed to go on over time, and that process goes deeper into your body, into your system, and creates more serious diseased conditions. So there is, of course, natural ways of treating inflammation, both acute and chronic. So let us look at how we can do this in a natural way. And as I have mentioned a couple of times, it is highly related to our lifestyle habits. So this is where we can participate in prevention of chronic inflammation and prevention of serious diseases. I would like to invite my audience to call in and ask questions. Here again is the number. This is a call-in show, 503-288-4442 or 503-288-4448. Or you can send in an email to life_ways life_ways@yahoo.com. That's life_ways@yahoo.com. We welcome your questions and your comments. So let us continue now to look at how lifestyle habits actually can create as well as prevent inflammation. Therefore, our lifestyle habits can actually create or prevent disease. The choice is ours, and this is the purpose of the show, to get you to think and to see that you are actually an active participant in your own health, and given information, you can choose how to prevent disease and how to take care of disease naturally, or at least not creating any more harm using a natural approach. So let's think olive oil, fish, nuts. All of these can lower your levels of inflammation. So the way in which we eat, or eating in a healthy foods, is very important. Eating unhealthy foods create inflammation, in short. So these oils such as olive oil and other types of oils from nuts and from fish can lower your level of inflammation. And this works by increasing the amount of foods you eat that are high in omega fats. That's what these nuts and seeds contain. Then you will have this ability to reduce or to ward off inflammation. So seeds like flax seeds, chia seeds, walnuts, soybeans, sunflower seeds are great. They're full of omega fatty acids. The sardines are great fish with a lot of omega fatty acids. Cod, salmon, tofu, and cod liver oil are all sources of omega fatty acids. Among fruits, blueberries, blackberries, melons such as cantaloupe, lemons, papaya, and many other fruits also are sources for omega fatty acids. I am just mentioning a few here, but the important ingredient in these foods is the omega fatty acids, which is capable of reducing and completely removing inflammation from the system. Here you see a picture of a Mediterranean diet. You're seeing that all these fruits and vegetables and oils that I just mentioned are commonly consumed in that type of diet in that part of the world. Flax seeds are very much available, as well as fruits, vegetables that we just looked at, nuts and seeds like walnuts, etc. Flax seeds is an excellent source of omega-3s, and the best way to use flax seeds is to buy them whole and then grind them yourself in a small coffee grinder, and then sprinkle it on your cereals, your salads, your food, whatever you're eating, and there is your source of omega-3. Very, very easy. Here is our next important step that we need to take. We need to get active. We need to exercise regularly, at least 4 times a day during the week. Of course, this is an easy way of getting the body flowing and moving, and this actually lowers inflammation. So make sure your waist size is normal. If you're a woman and your waist size is over 35 inches, or if you're a man and it's over 40 inches, that's an indication of inflammation in the body. That's an easy way to measure it. And of course, this indicates that you need to lose some weight. High insulin level is also a good indication of inflammation in the body. If it's over 3, then you should be thinking that you need to eliminate some of the grains that you may be consuming, and definitely you should be removing all sugars from your diet. There are, of course, many safe substitutes for sugar, such as stevia, agave, and some syrups like maple syrups are good. Also, this is indicating, if your insulin is high, that your pancreas is overworking, because this is the organ that produces insulin. And the pancreas is overworking because you're taking in too much carbohydrates or too much starch. This is a warning, by the way, that you're heading towards diabetes, and we definitely want to change that direction. So we need to reduce the starches and the sugars in the diet. Here's a picture of a diabetic foot, and we definitely don't want to see this picture or things getting to this extent. We can certainly make changes in the way we eat before we begin to suffer those consequences. Quitting smoking is very important. Smoking hardens the arteries and increase inflammation. You can reverse this damage over 10 years after quitting. Get your diet under control first, though, so before you quit smoking, so that you don't turn to junk food while as a substitute for cigarettes. Sleep is another important area that we are very much in this society. It seems like we always have so much to do that we sacrifice rest, and sleep is a big part of rejuvenating the body. If you do not get enough sleep, the body will not be able to repair, and this inflammation will increase. Actually, it shows that there are studies that have shown that elderly people with less than 7 hours of sleep are more likely to get heart attacks and stroke, which are related to chronic inflammation. So sleep is important for growth. Sleep repairs, refreshes, and rejuvenates us. This is when the body goes through repairing and getting rid of toxins and so on, is while we're sleeping. Stress is very much related to inflammation. High levels of stress actually promotes high levels of stress hormones, and this leads to release of chemicals that are precursors to inflammation. We have to have healthy outlets in order to get rid of our stress and our negative emotions. I will be talking about stress as a whole show shortly, because this is such a major problem in our society. So we need to get out more, get outdoors more, really. Gardening is great, yoga, meditation, prayers. This method of calming and reversing negative emotions, called emotional freedom technique, is also a great way to address stress. We will be talking much more about this. Vitamin D is such an important vitamin because it has so many profound effects on our health. What I'd like to focus on at this moment is that vitamin D deficiency is associated with many chronic inflammatory conditions and diseases such as hypertension, cardiovascular disease, diabetes, and all autoimmune diseases. Have been shown that persons who have these conditions or suffering from these conditions are low in vitamin D. In fact, 80 to 90% of the American population has been shown to be low in vitamin D. So vitamin D, we get this from the sun. creates vitamin D in the skin while interacting with the precursors for cholesterol, so this is free. The problem in this area of the country is that about half of the year we don't have much sunshine, so definitely this supplement is very important, especially in this part of the country where there's very little sun. I'd like to share with you now a few of the herbs and supplements you can consider using to increase your ability to get rid of inflammation if you have any conditions that, such as arthritis, etc., where you know you have inflammation. You can actually help yourself by cooking with these herbs and taking these supplements daily. Boswellia is a very important and famous herb for treating rheumatoid arthritis. Bromelain is the enzyme you find in pineapple, and this is a natural anti-inflammatory. Eating pineapples is a great way to get this. You can also take it as a supplement. We know that ginger is a great root for ginger tea for pain and relief of stomach aches. And this ginger is also a great anti-inflammatory. We can use this in many ways. I would like to share with you that we are actually talking here about culinary herbs as well. So the ginger, the turmeric, is tulsi, rosemary. All these herbs can be used in cooking. They're great in stir fries. Really, any type of dish you can add turmeric, for example. Here is some rice, turmeric, the typical yellow color of turmeric. Resveratrol, this one has become very much into our attention in the last couple of years. It's found in grapes, in the skin of the grapes. So we find this resveratrol, great antioxidant, in red wine. It also has anti-aging effects, so lots of people have been attracted to increasing their intake of red wine in order to take advantage of this antioxidant. Here are some oils that are rich in that omega-3 fatty acid that we talked about earlier. These oils taken every day as a supplement will keep inflammation away, and any of those conditions like diabetes, heart disease, chronic inflammation, autoimmune disease, all of these will benefit. In fact, it helps to clear up and control these diseases so that no further inflammation is incurred, and you begin to actually turn around these conditions, and you can actually be cured of these diseases. They are not necessarily something that you have to live with. The oils from these oils, as I was mentioning, have the essential fatty acid GLA. They're great anti-inflammatory oils, and arthritic pain, dry skin during the wintertime are some of the benefits that you get from the supplements. Here is the herb, the flower evening primrose, blackcurrant, and borage. So today we have focused on how inflammation can be a friend, and it is acute inflammation. And this is definitely very important for recovery from injuries. It's very important as the first step in the healing process. If we get a cut or we have some other kind of injury, that the inflammation starts off by limiting the damage that is caused and then sending information to the area from the immune system so that the inflammation can be limited and then the repair starts to occur. We can see, however, if this situation continues for some period of time where we are unaware that we have this inflammation going on, it becomes chronic inflammation, then this is a different situation. And this is where I want to pay close attention and focus. I'd like to take this opportunity now once again to invite you to call in. This is LifeWays Health and Wellness Show that occurs the third Wednesday of every month. It is a show that informs you about your health and how you can participate and engage yourself in keeping healthy. If you have some particular condition, we share with you how you can engage in turning around that condition and moving towards health. This is an effort to engage you in using lifestyle and healthy means to reach a health and wellness. Again, to call in, please call 503-288-4442 or 503-288-4448. If you would like to send us an email, go to lifeways@yahoo.com. That's LIFE_ways, WAYS, @yahoo.com. So to conclude, we have been focusing most of our attention today on inflammation as the silent killer, and this is the case for chronic inflammation. The acute inflammation is important that we are capable of mounting this immune response to injury and to simple things like cuts or bruises. But if it becomes chronic, then we have the situation where this can go on for a long time without our notice. This is why it's called the silent killer. And this chronic inflammation then shows up months or years after as an inflammatory process that has led to some chronic condition. We talked about a number of the conditions that are the chronic inflammation is the foundation for these conditions, such as ulcerative colitis, arthritis, nephritis, cardiovascular diseases such as strokes and heart attacks, myocarditis, asthma, any kind of inflammation of the joints, and also autoimmune diseases is based on inflammation. And this is where the body misinterprets normal tissue as non-self and attacks the tissue and creates these autoimmune conditions. Some examples of that is myocarditis, colitis, multiple sclerosis, lupus, etc. I think we have a call. Please go ahead, caller.
Yes, I'm calling in. I would like to know what can I do to reduce my total cholesterol level.
Okay, that's a little different topic, which I will be talking about this topic because in a different show because it has become such an inflated problem that it really is not. Cholesterol is important, The body produces cholesterol, and cholesterol is used as part of all cell membranes by the body. If there is inflammation, the body uses cholesterol to repair those areas. Cholesterol is the precursor for many, in fact, most of our hormones, such as estrogen, progesterone, testosterone, aldosterone, and so cholesterol is not the problem, as it has been made out to be. What is happening is that cholesterol is responding to inflammation. It is responding to damage that occurs, for example, in your arteries. And why is this damage occurring? Because we are taking in, say, sugars that are really a destructive force in the body. For example, the crystals of the sugars scrape the walls of the arteries as the blood flows through it, and then the cholesterol comes to heal that damage and creates the foundation for a plaque that then narrows that arteries. The volume of blood then becomes limited, that is able to pass through the arteries, and this can lead to cardiovascular disease. So that is really the story behind the connection between cholesterol and cardiovascular disease. It is not the cholesterol that is causing the cardiovascular disease. It is the damage to the arteries and the hardening of the arteries by inflammation that is narrowing the arteries, and the cholesterol is responding as it should. So this whole story that is built around how terrible cholesterol is, I want to clarify this understanding for you. In fact, it is important that you know that statin drugs, which are often given for cholesterol, has some serious side effects. So it is also not dietary cholesterol that is creating the problem. The liver normally produces cholesterol that addresses these damages, as I mentioned earlier. I would recommend that you eat healthy fats, such as olive oil, flax seeds, and other nuts and seeds that I mentioned today, oils like borage or evening primrose oil or blackcurrant oil. These are all great supplements that will reduce inflammation in your body. So that is the way to approach lowering your risk for heart attack, and of course exercise is a big piece of that as well. Do you have I answered the question? Okay. All right, so let us continue in wrapping up here our conclusion that chronic inflammation is really what we need to be paying attention to. It is the basis of many, many chronic inflammatory diseases. In fact, it is related to most chronic diseases that we have mentioned, quite a few today. These conditions many of them are debilitating or life-threatening. So what we need to do is learn how to engage in or adapt healthy lifestyle habits that is going to promote how we deal with inflammation, such as eating healthy, exercise, adequate sleep, and be able to distinguish between environments that will cause us to create a situation of further inflammation in the body. So over time, we see that this inflammation can be damaging to us. We are completely unaware of it. And so it's time to really look at how we are living, because these lifestyle habits that we are engaging in is largely what is promoting chronic inflammation in the body. And therefore, we're talking about it's our lifestyle habits that is creating disease. If we change these lifestyle habits, it will not only reverse the disease, but we will begin to experience what it really means to be healthy. So with that, I would like to encourage you to continue listening as we bring you Lifeways the third Wednesday of each month. I am Dr. Carolle Chapman. I'm a naturopath here in the Portland area. You can reach me, contact me at the Brooklyn Natural Health Clinic, which is located in the southeast area of Portland, Southeast Milwaukee Avenue. And we look forward to talking to you next time about allergies. Allergies is also related to inflammation, so we will be looking at that next time. Thank you and good evening.